So, before we move on to Lesson B, Essential Care Services and Support, let's go over what we learned in Lesson A. We talked about your role, typical home health aid organization structures, your responsibilities, personal care, errands and shopping, chores around the home, supporting your clients, and most importantly, asking for help if needed. So let's move on to our essential care services and support. Now, the key definitions for this module is long term care, which is services for people who need support for a longer period of time, people with disabilities, older persons that can't walk alone or need a walker or a wheelchair, acute health services, smaller services for people who suddenly became ill. So it's a kind of a short period of time, a descriptive period of time. And a person who may have had an accident, and so there's a shorter period of time or a known period of time when they will or they should be feeling a little better or getting well. Examples could be seeing a doctor for flu, or going to the hospital after a heart attack. So these are short period of time instances where we're waiting for a person or helping that person get to a better state or become well. Home and community based services. Many long term care facilities can um, be offered in a person's home or in assisted living facilities. But as you know, most people are happier at home. Private pay is when individuals pay out of pocket. I'm seeing more and more of these services where individuals, they want a little bit higher level of care. Sometimes Medicare and Medicaid, they give pretty good care, but it's limited. So people are paying out of pocket, especially if you don't qualify for Medicare and Medicaid as well. The public programs, as I stated, Medicare, Medicaid, there's some state programs, and some organizations offer programs. And most, not all, but most people who get these programs are lower income individuals. So, who can get these services? Home health aides provide care to individuals um, of all ages, and I'll share a story of that. But with the primary focus of when we think of home health aides, we think of elder care. But elder or older adults are considered adults who are age 60 and older, who may be frail or vulnerable. Then, in cases, sometimes we teach individuals or persons with disabilities. For example, this can include a person using a wheelchair, following an accident, or an individual living with mental illness. And then we don't see it often. I'm seeing it a little bit more, and it's children or um, teenagers up to age 22 with closed head injuries, may have been in a car accident, or may have had a gunshot wound. And so we were invited. My school was invited to go and visit a closed head injury organization or facility. And in that facility, they set up training for us and talked about the various aspects of the brain, and if certain aspects of the brain are injured, these are the results that you could see. And it was very interesting. So helping children or adults with developmental disabilities could also include um, individuals with autism, cerebral palsy, epilepsy, and cognitive impairments, like I just shared. So home health aides can span across any uh, any aspect of healthcare, and that's why you're needed so often. So, what are the qualities of a great, not a good, but a great home health aide? Compassion and patience. Whew. So, delivery of compassion, gentle care that respects both the emotion and physical needs of each client. And that does include you. There are times where you may be helping someone and it just feels as though, you guys are bouncing back and forth. Nothing's getting done. At that moment, before getting upset, losing your cool or your temper, step away. That's self care. That's the best self care. Make sure that they're safe in a safe place and just step away, you know. Housekeeping and homemaker, that's one who just comes in, and some of these roles you can do just these roles. And I was shocked that there was a person that all she did was bed baths, and she charged a lot to do bathing. So she would do bed baths or get the person up and put them in the shower, give them a good scrub, rub a dub, and that's all she did. And she went to the next person, next client. All she did is wash them up, scrub, rub a dub, next client, and she made a killing. She did very well financially. So there's ways that you can, really work for yourself and do well and work for a company. You can do, like I said, personal care. You can just go in and your home focus is on being a homemaker, or cleaning up, tidying the home, doing laundry or two, attendant care, which most of us do, encompasses both personal care and household maintenance. And then respite, I love that one as well, because you're just coming in. That's a new one, as well. That's when you go in and you're just giving the family member or the caregiver a break. And, since more and more individuals want to stay home, that home caregiver needs a break. And so that respite caregiver would come in, if the person or the daughter or the cousin or whoever needs to get out to go shopping, have a doctor's appointment, whatever. So you're there from maybe 2 hours to 3 hours to allow them to get their um, personal things done as well. There's more and more need for home health aides that just offer respite care. So, we have just gone through a very short lesson on what are our specific facilities, who can get these public services. And we know that it's older adults, persons with disabilities, children, and adults with developmental disabilities as well. And then what's a quality or great qualities of home health aides? One thing that I'd like to share that's not on there, a good quality or great quality of a good home health aide is also that you're wearing your scrubs every day, and your scrubs fit you. They're not so tight that when you bend over, your girls are showing, or so tight that um, we can tell whether or not you have on underwear. And I'm seeing a lot. I mean, it is what it is. If we put our scrubs in the washing machine and it shrinks, that's one thing. But if all your scrubs are so tight that you can barely stoop down, or when you stoop down, I see the first part of your tail crack, or I see all the girls, it's time for you to maybe wear your scrubs a different way. And I've had this conversation, and I've gotten some people would say, "I like my scrubs this way." But you're not wearing your scrubs for you. You're wearing your scrubs for your clients. That's your uniform. Can you imagine, just I won't even go there. Just be professional. And then when you come in, greet, the families. Greet not only the customer, but greet their families as well. And so that's some good feedback that I hope you take to heart. All right. So next, you have some learning checks. And so with these learning checks, you can either do them in your workbook, or you can do them in the system. And so what you do is you go over, let me see if I can bring it over. It'll be over in this section. Let's see if I can move this over, and it will say learning checks or exam. So I will do my best to make sure that that's there, but just wanted to show you the area where it you should find it. And so you'll just take those learning checks. It's not graded, but we'll go through at the end of the chapter and we'll look to see what your grades are. All right. So I look forward to seeing you for lesson C. Good luck on your assessments. See you in a moment.